Why are health insurance companies suddenly hiding information about their executives? Is this about ensuring safety after a shocking incident, or are they trying to keep something hidden from the public? Let's explore the reasons behind this sudden shift and what it means for us. The recent event that started it all. The tragic murder of Brian Thompson, the CEO of United Healthcare, sent shockwaves through the corporate and public sectors. Thompson was targeted in a high-profile attack in New York City, which raised concerns about the safety of executives in the health insurance industry. His death sparked not just grief, but a wave of online reactions that ranged from anger to unsettling humor. Social media platforms were flooded with comments reflecting public frustration with the health insurance system, some even praising the attack. This troubling event prompted health insurance companies to take immediate action to protect their leadership teams, but it also raised questions about transparency and accountability. Are these measures purely about safety, or do they reveal deeper issues within the industry? What actions have companies taken? Following the murder of United Health Group's CEO in December 2024, major health insurance companies have taken substantial measures to protect the privacy of their executives. Key changes include United Health Group. The company's entire leadership page has been removed. If you try to access it, you're redirected to the homepage. This step highlights a dramatic shift in how the company manages its public image. CVS Health. Photos of top executives have disappeared from the company's website. This action minimizes the visibility of their leadership team. Elevance Health, formerly Anthem Blue Cross Blue Shield. The About Us section, which previously featured leadership details, has been taken down entirely from the homepage. Humana. Information about board members has been removed from the company's website, further signaling an industry-wide trend of increased security measures. The recent actions by health insurance companies stem from two major concerns. First is security concerns after high-profile attacks. Brian Thompson's murder highlighted the growing risks faced by public figures in high-pressure industries like health insurance. Companies are taking drastic steps to safeguard their executives against potential threats. Second, growing risks due to social media and rising tensions. Social media has amplified public outrage over contentious issues, and the health insurance industry often finds itself in the crosshairs. The anonymity and reach of these platforms make it easier for discontent to escalate into real-world threats. The removal of executive information may protect leaders, but it also creates a barrier between the public and those in charge. Health insurance companies are already viewed with skepticism, and these actions could deepen mistrust. Transparency is crucial for building confidence, and limiting access to leadership details can feel like an evasion of accountability. Why do people dislike health insurance companies? Many people harbor strong disdain for health insurance companies and their executives. The main reasons include denied claims. Patients often face denials for necessary treatments, leaving them to shoulder the financial burden or forego care altogether. High premiums. Rising costs of insurance plans contribute to frustration, especially when coverage doesn't meet expectations. Perceived greed. Executives are often seen as prioritizing profit over patient care, reinforcing negative perceptions. Complex processes. The bureaucracy of insurance claims, prior authorizations, and appeals can make people feel helpless and unheard. Impact on lives. Stories of lives lost or worsened due to denied coverage fuel anger and resentment. This frustration is amplified by the personal nature of healthcare. For many, health insurance represents a system that prioritizes money over humanity. The insurance denial epidemic. The issue of insurance claim denials has become a major problem, especially with companies like United Healthcare. In 2023, United Healthcare rejected about 1 in every 3 claims, which is the highest rejection rate among major insurance companies. United Healthcare had twice the claim denial rate of industry average of 16%. From the graph above, you can see that United Healthcare has always been on top for denial rates, exceeding the rest of the companies by a huge margin. The reasons behind these denials are often murky and frustrating for consumers. Divya Sangameshwar, an insurance expert at Value Penguin, explains that many denials occur when insurers determine that a doctor-recommended treatment falls outside of coverage. This creates anguish for patients who are left without options for vital care. United Healthcare's practices have not gone unnoticed. A Senate panel previously criticized insurers, including United Healthcare, for denying coverage to elderly patients in need of care after strokes or falls. These rejections exacerbate public resentment, especially among vulnerable populations who depend on insurance the most. Adding to the tension, Brian Thompson's murder has brought renewed attention to these issues. Law enforcement found messages on the ammunition used by the assailant that read, "Deny, defend, and depose," seemingly referencing common tactics in the insurance industry. While the motive remains under investigation, the incident underscores the growing frustrations many have with health insurers. "My heart goes out to people who have a medical issue and find out their health insurance is inadequate," said Sangameshwar. This inadequacy, combined with rising premiums and opaque processes, fuels a cycle of mistrust and anger toward the industry. Comparison to other countries, the U.S. healthcare system is unique in its reliance on privatized insurance, contrasting sharply with countries that have universal or single-payer systems. In countries like Canada, the United Kingdom, and Sweden, healthcare is publicly funded, offering coverage to all citizens. While these systems have their challenges, they generally deliver better outcomes in terms of cost, access, and public satisfaction. For example, in Canada, citizens enjoy free access to essential healthcare services, funded through taxes. While there may be waiting times for non-urgent procedures, no one is denied care due to inability to pay. In contrast, U.S. patients often face exorbitant medical bills, even with insurance. Administrative costs in the U.S. are so significantly higher, contributing to its status as the country with the highest per capita healthcare spending in the world. Let's take a quick look at the bar graph below, and as we can see from the statistics, the main reason health insurance claims get denied is because they don't have prior authorization, and that's 48%. This means the insurance company needs to approve the cost of a medical procedure before it's done. If this approval is missing, the claim is likely to be rejected. And as you observe the other reasons, you notice how insignificant the reasons are, as if the insurance companies are just finding excuses to deny the claims. The power of health insurance companies in the US cannot be overstated. These corporations wield immense influence through lobbying efforts and political donations, shaping policies to protect their interests. The industry's lobbying arm spends billions annually to oppose reforms like Medicare for All, which would introduce a government-run system. Additionally, the fragmented nature of the U.S. healthcare system creates a complex web of stakeholders, from insurers to pharmaceutical companies, each with vested interests. This makes large-scale reform challenging, as any changes threaten the profits of these powerful entities. Despite these challenges, movements for reform are gaining momentum. Medicare for All, championed by progressive politicians, proposes a single-payer system that would eliminate private insurance and provide universal coverage. While the proposal faces significant political opposition, it has garnered widespread public support. At the state level, initiatives like California's push for a single-payer system represent efforts to implement change on a smaller scale. These programs aim to demonstrate the feasibility of universal healthcare, potentially serving as models for national adoption. The intersection of safety, transparency, and systemic issues in healthcare highlights the complexities of the current landscape. From the removal of executive information to the high rates of claim denials, these challenges underscore the need for meaningful reform. By examining the broader picture, including comparisons to other countries and the entrenched power dynamics in the US, it becomes clear that the road to change will not be easy. However, the ongoing reform movements offer hope for a more equitable and accessible healthcare system in the future. So what's your take? Will the US ever move away from privatized healthcare? Let us know in the comments, and don't forget to like, share, and subscribe for more deep dives into today's most pressing issues.